I'm joined in studio today by the brain trust of the organization. I'm joined in studio today by with Nicholas Vendittelli and Jason Pollock. Guys, how are you?
Great.
Good.
Yeah.
Good
Things
to be
are good.
here.
Things are good. Spring's sprung.
It's here.
We've had some nice weather. A little cooler today. We're having this this podcast in the towards the end of April, but. I want to talk about a really important topic for our viewer and our listener, and it's Canada's healthcare crisis and a private solution for individuals. And, Jason, if you think about it right now, we've always talked about, the healthcare system here in Ontario and what's happening across the country. And I think if you look back at it, between 0 years of age and 50, those are your reactive years. You get sick, you get hurt, you go to the doctor, you go to the hospital. Mostly reactive medicine. Between 50 and 100 years old, it's more proactive medicine. You want to be more proactive in your discipline and your health. And I want to talk today about some of the issues facing the healthcare system. One of them right now is the massive backlogs in both doctors here in the province of Ontario, getting in to see a specialist. God forbid you get hurt, you get sick, you need something done. It's hard to get in to see a specialist. Surgeries, because of COVID, are completely backlogged, thousands and thousands and thousands of cases. And of course, we have some of the treatment issues. And I think, Jason, if you ask around and talk to your clients, you're sensing this is a big issue with most individuals.
For sure. And the population is getting a lot older as well, and we're living longer. So you're seeing more and more of those preventative or more and more of those surgeries needing to be done.
Absolutely. And Nicholas, are you seeing it too with talking to clients and friends and family?
Yeah, a lot of people I've seen at the gym. I remember there was one individual, hip replacement, over 11 months, right? The wait times are pretty bad. Yeah, and it's unfortunate, and living in that discomfort, right, for that long.
Well, it's scary when you're not thinking about it. It's not really a big deal, but when you hit our age, Jason, you start feeling it. I mean, I'm feeling the knees, and you're feeling
50.
Feeling a few things
50
too.
was the age that
right?
it just changed for us.
The body starts to break down. So what's the solution? So I was at a seminar about a year or two ago, and I heard a presentation from a company called Best Doctors Canada. And it blew me out of the water. And I want to get into some of the slides we're going to share with our listener and our viewer, obviously, today. But I want to get into the first slide here, Jason. And if you look at Canada right now, in 2010, back in 2010, if you looked at an efficient timeline to get treatment from your GP to treatment, it was about 6 weeks. The real number back then in 2010 was more closer to 9 weeks. If you fast forward 13 years, like in 2021 right now, if you want to get in to see a doctor and then you want to get treatment done, it's over 14 weeks. So we've seen more than a 50% increase in the waiting times and the difficulty of getting in to see a specialist and getting treatment done in 2021.
Yeah, it's crazy, and it's getting worse. And some of the things that we've talked to some of our clients about is this median wait time, the time that it from referral by a GP to actual treatment. And just some stats here. In 1993, the average number of weeks it took to go from GP to actual treatment was about 9.2 weeks. Today, that was in 1993. Today, or in 2021, we're double that. We're at 18.5 weeks. So it's basically doubled to get the treatment that we deserve.
When you break down 18 weeks, that's 4.5, 5 months. Yeah. And if you've got an illness or an injury, man, to sit around the house and suffer for 4 or 5 months is it's incredible how the stress and the pain suffering it must take to fight through that.
And that's just in Ontario. So some of the other provinces are way worse. This is Ontario stats, but
in our chart right here, we're lucky. Ontario is one of the better provinces of getting this type of work done. British Columbia. So again, Ontario's 18.5 weeks from GP to surgery. In BC, it's closer to 26 weeks. Alberta closer to 32. Saskatchewan 30. The worst culprits are the Maritimes. Man, you do not want to get sick in the Maritimes because if you live in New Brunswick right now, It's about 41 weeks to get treatment, to get surgery. In Nova Scotia is the worst province in the country. It's around 53 weeks. And of course, PEI is back at about 41. So, I just can't imagine having an illness or a needing of a surgery in Nova Scotia and having to wait almost a year, Nicholas, to get something done.
Yeah, even going into more detail. So as we're talking about the median wait time. So if you get into specifics now of the types of surgeries, whether it be gynecology, plastic surgery, so some pretty staggering numbers here. So for general surgery, we have an 18-week period, so about 4 months. Orthopedic surgery is about 11 months. And again, that's median. It could be a lot worse. Right. So as we were talking about, there's an aging population here, and you got to think, right? So individuals who are needing orthopedic surgeries, hip replacements, knee replacements, they're having to struggle through 11 months of their lives, potentially not even being able to
losing
move
their
around.
lives for 11 months because they can't do anything.
They're,
right?
handicapped quite literally. And the wait times are they're really bad, unfortunately, in Canada.
Yep. And the other thing too, the one good thing about the survey that we're reading here is that oncology is the fastest. So if you do have God forbid, a cancer scare, the wait time for cancer is about 4 weeks. So if you do get diagnosed, right away, they're fast tracking you. But yeah, the median time, obviously 25 weeks. I mean, I can't imagine having to wait almost a half a year to get a surgery done and living in that world of discomfort. So the next slide here I want to get into is a product by Best Doctors, and it's called the Global Medical Care Program. So Best Doctors is a company, they're based in Toronto, they're underwritten by Lloyd's of London. So this type of contract has 3 specific areas to it. There's the medical assessment component, there's the medical services component, and then, Jason, there's the medical insurance component. So what happens is you can buy insurance now to basically fast track your diagnosis, fast track the MRI, and if you want to, you can take this global health card, which is about a $5 million global health card, down to the U.S. or somewhere around the world, and get your treatment done.
Yeah, and so you had mentioned the first stage or the first step is called the medical assessment. So basically, you can do this annually, every 12 months. And what they do is obviously you meet with a doctor and they do a complete overview. They do a complete assessment, a head to toe assessment on all your health issues. You do it at a world-class clinic across Canada. Nicholas will talk about some of the different spots in Canada, and they also look at some of the future health risks. So they'll say, they'll take a look at your assessment. They'll determine whether you're predisposed for any other health issues down the road, and based on that assessment, they'll coordinate some of the care throughout the country.
Well, it's one of these things where you think about it. How great would it be in your 50s to maybe once every 3 years go in, head to toe, take my blood work, take my this, take my that sample, do this, do that, weigh me, take x-rays. And when I walk away after an 8-hour assessment, I get a full picture of the good, the bad, and the ugly. And unfortunately, our medical system isn't designed to be preventative. Our medical system is designed to be reactive. So again, you have a cold, you go to your doctor, you book an appointment, you get a prescription, you go home. And again, the medical system, I really feel bad for some of these doctors these days because they're overwhelmed with the amount of work they've got to deal with writing a prescription and helping people in basic needs. There's no chance that very difficult for most doctors to provide this type of a treatment, Nicholas.
Yeah, and like Jason was mentioning, so we've got lots of clinics across the provinces. Of course, talking about Ontario, we have 3 that are the closest to us in Toronto. That's MedCan, TELUS, and Cleveland Clinic. And as you were mentioning, these are the places that you're going to go and get that top-down assessment, and they're going to, hope, God forbid, not find anything. But if they do, this plan is going to give you the tools to then expedite your care and get somewhere that you can get, that treatment ASAP.
Absolutely. I mean, for us, and by the way, for full disclosure, I just purchased this type of insurance, and one of my first decisions is going to be to go to Toronto and get the full assessment, spend 6 to 8 hours in the Cleveland Clinic or MedCan, and hopefully I come out with a good report card. The second stage of the program is you've gone to get your treatment done or you've got an issue. Then we have stage 2, which is basically allowing you to go in there and have some MRIs done, some CAT scans done. One of the big issues right now is I've been waiting for an MRI on my ankle for about 4 months now. I'm guessing I'm probably a few months away. If I had the plan and I had the issue, I could within about 3 days go to a clinic and get my private MRI or my private CAT scan. Now, we live close enough to Buffalo, but if you go to Buffalo to get a CAT scan or an MRI, you're looking at $500 to $600 US. So again, this medical expert plan within the Best Doctors program, it gives you the expert medical opinion. It finds a doctor for you. If you have a problem and you need something done, they will find a doctor for you. They have a care finder, so they'll find the facility, the conditions anywhere in the country, possibly even North America and the world. You get a personal health navigator, so you get a concierge person that's going to help you through all this. And again, they've got elite diagnostic imaging services. So again, step one is we get the assessment done every few years or as needed. Step two is we need something and we have access to getting the answers right away.
Yeah, and you had mentioned going down to Buffalo, but you know, if you had this product, it's wonderful and it'll be covered. But if you don't, there's some significant costs. I mean, we all know it. For, you know, just a couple of examples, in the States, a cardiac valve or other major cardio procedures can cost about $700,000. Like chemotherapy, if you have any acute leukemia as a secondary diagnosis, that can be upwards over $500,000. We've seen it. We've heard about it before. The costs in the U.S. are astronomical.
Yeah, and what we will find too in the U.S. is that they do have the greatest healthcare system in the world. I mean, our system covers, you know, A to Z every citizen here in this country, and it covers it on a pretty solid basis. But I think if you asked any medical professional, if you had to have something done, you know, the U.S. is probably years ahead of us. Obviously, they're mostly private medicine. They're competing for that patient. And again, Jason, I mean, pretty difficult if you had a heart condition. Not only are you going to wait, you know, 6 to 12 months to get the treatment here in Ontario, it'd be a tough ask to jump into your RSP account or your TFSA account to find $500,000 or $600,000. So absolutely, you know, this global card is going to be there for you to travel. And by the way, for those out there, just so you know, we will get into it in a second with Nicholas, but this Best Doctors program provides a $5 million out-of-country credit card. So you have a $5 million credit limit per person. You can buy it as a family. You can add your kids onto it. $5 million per person. That's a lot of credit card money that you can use to fight some health condition, Nicholas.
Yeah, for sure. And as we were talking about the costs, of course, those are pretty serious health conditions. Now, let's just say you have some orthopedic surgeries or other ones. You know, $5 million, I think, is a really good amount, right? As a lifetime plan maximum, it's going to offer you a lot of cushion for that care, of course, going potentially if it's Europe, if it's the United States, maybe even Canada. It's going to give you access anywhere and everywhere as long as it's the best. And now building out that plan, of course, it's based on deductibles, right? So you have 7 choices. Anyone within their budget has lots of flexibility, whether they want to have their premium more affordable, whether they want to play a little bit more and have a smaller deductible, so they can have that as an option. It's renewed annually, and everything else is really bundled in the plan. You've got cancer treatment, dialysis, inpatient, outpatient, everything 100% coverage there. So it's really holistic. There's nothing hidden on this plan. It's going to give you coverage for anything you need.
Exactly. And the plan that I'm looking at, again, you can change the plan as you age and the price goes up. These plans work in a 5-year interval. So every 5 years you change your age bracket. The rate changes a small bit. It's really, really, really inexpensive and affordable for those under the age of under 50. Yep. Even myself, I'm 54. And I think the plan for myself and the 2 kids was roughly $250 per month. Okay. If you're a business owner, there's ways that we can have the business fund that expense and get a bit of a tax deduction. So there's some benefit there if you're a business owner. Last key point here is when you do take this plan, if you wanted to, there's a couple additional features you can add on to it. You can have a travel rider built into it. So again, they will produce some dollars if you want to fly your family down to the surgery. You know, if you're going down to Chicago for an operation and you want to have your wife or your kids there, there's some travel dollars built in. There's also an outpatient drug rider. So there's a rider that if you had a surgery and let's say you don't have the coverage for your health plan, you don't have the drug benefit here in this country, there is a $45,000 a year prescription drug outpatient coverage. So again, for those that that maybe don't have a really solid plan through work, and of course, there's also an option for your diagnostics. You can add in that as well. So it's a very broad menu of services. It's a very broad choice of what you want. You can custom design it. Our feeling is that anybody now, in their 40s, over 50, it's at least it's worth looking into. And what I will say is that I don't know, Jason, of any firm that I've even talked to in the financial planning world that's even talking about Best Doctors. It's really, it doesn't have much traction in the marketplace. It's very much a unique product. And I think for us to share it with clients, all we want to say is, hey, listen, look at it, look at the features, look at the benefits. If you want to talk more about it, great. If it's not for you, no problem. But the last thing we want to do is not talk about it, and then at some point down the road, one of our clients has a health issue and says, I wish I had, I wish, right?
Yeah,
exactly.
And how many over 50-year-olds do you know that don't have any issues, some kind of issue? Yeah. We all do. Unfortunately, hopefully most of them are minor, but we're not young bucks like this guy anymore, so things are breaking down.
And I will say, right, it's one of these things where you want to get it before you get sick, right? Yeah. So if you're healthy and you're in your 50s, 40s, late 50s, 60s, and you're healthy, the best time to buy it is when you're healthy. If you've had a few health issues, you can still purchase it. They may have an exclusion for that type of illness. So if you had a hip issue that you've been fighting for 10 years, you can still have the plan, but they might exclude that benefit. Nicholas Vendittelli, Jason Pollock, again, thanks for coming on to the show.
Great to be here.
Awesome, great content.